Normally in the hospital you'll be staying on an antenatal ward if you are still pregnant, if your midwife and doctors feel there's a reason to admit you into the hospital. You'll go to a specialist ward when you are in labour and for the birth. This is called different things dependent on where the country you are. It might be labour ward, delivery suite, birthing ward, or any of those words. A few hours after you've had your baby, if you are well and everything is stable for you and baby, you'll usually go to stay on the postnatal ward, unless you've decided to go home straight from the birth ward if everything was straightforward and you're feeling really confident about that. Some hospitals do have a combined antenatal and postnatal ward, but you'll generally be with people who are either pregnant or after they've had their baby. When in hospital, it's typical that you'll stay in a bay with a few other women or birthing people. Your bed will generally have a curtain around it, and you can choose whether you want to have those curtains open or whether you want to have them drawn. You will then usually share a bathroom with the people that are in the bay with you. Some hospitals also have single rooms available. If you're autistic, if you feel that you would be calmer to have a room by yourself, it would be a good idea to talk to your community midwife to ask for a plan to be made where you would be eligible to stay in a private room, perhaps even with an ensuite bathroom as well. Ask your midwife what times your birth partner can be with you on the various ward areas. If this is limited times, then this would be difficult for you, particularly, for example, if you struggle with communication or anxiety and stress. Again, talk to your midwife in advance to see if an adjustment can be made so that your birth partner can support you by staying with you on those environments. Most hospitals do have free Wi-Fi, a really good little point there. Other things that you might want to think about whether you'll have access to a fan in the hospital or if you need to bring your own if staying cool is important to you. Hospital wards are often very warm in order to make sure that the new babies don't get cold. But you can often have a personal fan as long as you make sure baby is not in the draft. That will generally be strongly recommended. Other things I would encourage you to ask about before your admission to hospital are what times meal times are. And will you get these brought to you or do you have to go and get them? How do you get the food? Is there a patient fridge so that you could place snacks in them, or a place for you to bring your own food or for you to get food if you're hungry? If you have any sensory needs with any foods, please do discuss what adjustments may need to be made so this can be included in your notes. Things you might also want to ask about are the lighting and whether you can have low lighting if bright lights are concerning or triggering for you. You can often take in your own music to make the space more relaxing for you. Having your hospital bag prepared nice and early in case you're unexpectedly admitted to hospital might make you feel more relaxed in the eventuality of this happening. It is important for you to understand the time that things happen in hospital can change. So if the times that things happen are really important to you, and if you'd like to be prepared about what time things are happening, if somebody says I'm coming in 5 minutes, if you will literally expect them to be here in 5 minutes, please do talk to the midwives about that. Because very often in hospital, things can change at very short notice, dependent on what's happening with yourself or with the activity levels on the rest of the ward. Knowing that you need to be informed as quickly as possible if there are any delays to your care or any changes to the plan will help the midwives to be mindful if this is needed. There can be delays, for example, in anticipated events happening, for example, the time of a medication being given or of some bloods being taken. There can be delays when you're waiting to be discharged home, or sometimes it's just about changes to the plan of care that were initially agreed. And you might feel that one midwife says one thing and one midwife or doctor says the next. This will usually be in response to that changing situation. The care you are given will depend upon the reason that you've been admitted to hospital. Asking the midwives about this care and about their plan will help you. You can also ask what happens overnight so you understand what you might need them to do in order to support your needs individually during your stay in hospital.